Thanks for checking out our channel. Stick around for a special message.
This swollen elbow joint, you can see I'm going to push here. Does that hurt, by the way?
No.
It's not a painful problem. No. So this just showed up a couple of days ago, right?
Yes.
And you didn't fall and bump your elbow or
no.
Nothing like that, right? Nothing like that happened. Good. Okay, so what we're just going to do is use a little betadine. We're going to clean this up, and we don't want to get an infection. So
I was sweeping in the garage. I told my wife I can't do that anymore. She has to do it. So I got out of that.
Good. Yeah, it's always good to injure yourself to get out of household chores. I'm a big fan of that myself. Okay, so we're going to see if we can get Gonzo to spray some cold spray. And what we're going to do is, you're not going to look because we're going to stick a needle in there. We're going to try to draw that fluid out for you, okay?
All right.
Come on, Gonzo, go. Gonzo,
I think it's out.
When she went to the medical assistant school, she didn't do well with spraying cold spray.
I didn't.
Did she pass?
No.
No, in fact, I think
it's out.
Do we have another one in here?
No.
Go quickly.
Here.
Well, turn it off and then we'll restart. Okay, this is part 2. So we have our cold spray. You ready? There we go. Nice and cold. More. Good. Little stick, okay? If you feel any pain, you're going to tell me, right?
I'm going to try to.
Look at all this fluid coming out, guys.
Oh, wow. That's a lot.
It sure is. In fact, we're going to pull this out. And we are going to get rid of it. It's so much.
The Walgreens, or where you get them at?
Oh, yeah. You can get them just about anywhere.
Okay.
All right, you're going to feel a little stick. I'm going to put a little just a little bit of cortisone in there for you now, okay? All right, you may feel a little stick on this one, but not much of one. You ready?
Yeah.
Little stick. Was I right? Felt a little bit of a stick, but not real bad, right?
Oh, yes.
All right. Yes. All right, look at that. Man. You're a good patient. You're easy to get along with.
Good.
I'm going to set that right there. Good. I think we got the fluid out. This is an olecranon bursitis is what this is. And the fluid is just, a byproduct of the inflammation. So we put a little cortisone in after we pulled the major part of the fluid out. And now what we're going to do is we're just going to wrap this. And we're going to put our patient on an anti-inflammatory. And he should do just fine. Great work.
Bye. Don't go anywhere. The Meta 7 video is coming right up.
Okay, why don't you tell us about your experience with Meta 7?
Okay, well, first of all, I started taking them, but I was not taking them as I was supposed to. So finally, I decided just to take it as I am supposed to. It is great. It's like, oh my God, I cannot live without that, because it's like energy. I feel more like in control of myself. That's the best thing. So honestly, from now on, I am not going to miss a day.
Awesome.
I love it.
So you were just like taking it once in a while.
I was taking it like maybe 2, 3 times a week.
It wasn't really working, was it?
It worked when I take it just a little bit, but I didn't know.
Not like, right. You didn't know that you have to take it every day to really feel the effect.
Yes, I didn't know the 100% effect.
Wonderful.
Once I took it for 2 weeks, I mean, I'm sold on it. 2 weeks and that was it. I'm like, I really need to do this on an everyday basis.
Awesome. Thanks so much. Hey guys, Dr. Gilmore here. Thanks for watching our videos. If you like pimple popping and you've always wanted to do your own pimple popping, we've got just what you need. Super Pimple Popping Kit. Has everything you need to get the job done right. The instructions for getting your own Super Pimple Popping Kit are in the video description box below. Thanks again for watching.